and also all of the proposals that we know are out there, including those put forth by MedPAC, phase 2 of the Part B demonstration, if approved, for example, is that many of these reforms rely on some kind of definition of value, right? And most of the proposals do not actually assign a definition of value because, of course, that is kind of the age-old question. And so what you start to see is a pattern that starts to address this issue, again, not by saying, here is the value threshold for this particular drug, but rather pointing to outside entities. And so, there's been a lot of attention, for example, on value frameworks that are emerging in the market. And, many stakeholders have focused on value frameworks from a commercial perspective, from an internal and external communications perspective. But what we're seeing is that value frameworks over time are likely to have a really significant impact on the public policy landscape. So when you see CMMI, CAP, NASHP, all kind of reference independent entities and rely on independent entities to determine and assign a definition of value to advance drug policy proposals, it becomes increasingly important for industry stakeholders to be following the evolution of the value frameworks, not just for their implications, on their business today, but also for potential implications in the public policy dialogue going forward.